Thank you. Let me just start with a little bit of a brief bio for the good doctor here. So Dr. Murthy is all of 38 years old. He was born in England, moved to Miami, Florida at the age of 3, I believe, attended Harvard University, earned an MD from Yale, was nominated for the post that he currently serves in 2013, held up by Senate Republicans because he refused to recognize the public health benefits of bullets. In December 2014, finally confirmed for the post. Most importantly, though, this past August, only a few weeks ago, he got married. So give him a round of applause, please.
Thank you. Thank you so much.
So in his time as Surgeon General, Dr. Murthy has placed emphasis on things like preventative medicine, vaccinations, and he's been promoting walking. And so my first question to him is, did you walk here today?
Well, great question, Sam. And it's good to be here with all of you. I did, in fact, walk here today.
You did not.
I did.
It was raining out.
Yes, I had an umbrella.
That's impressive. Give him a round of applause. All right, so I want to start, it's sort of a grim anniversary today, or I should say yesterday. Yesterday was the one-year anniversary of the first diagnosis in the United States of Ebola, Thomas Eric Duncan. And I'm wondering, as you look back at that time period, if you can talk about things that you learned and observed, both about our medical institutions here in the United States, but also about the way that social panic can take over a population when confronted with a rare infectious disease like Ebola.
Our country over the last year went through an extraordinary amount of challenge with Ebola. As many of us remember, it was all over the news. There was panic in cities and towns across America, and there was panic really across the world. People didn't know how far the outbreak was going to spread. They didn't know how it would impact them and how long it would take to get it under control. But the good news is that I think we've learned a great deal over the last year. You know, our hospitals are more prepared. Our healthcare professionals are better trained. Our lab capacity has expanded beyond what it was at the beginning of the outbreak a year ago. And equally as importantly, we've actually strengthened our partnership with countries like Liberia. Yeah. And this is the one important piece of learning I think we've taken away from this, or a lesson that many people knew but that many more people know now, which is that in 2015, domestic health is global health. What happens in other countries impacts us. And we can't wall ourselves off and believe that we are going to protect ourselves solely by doing that. But we realize that poor infrastructure for health in other countries has an impact on us. And as we come out and recognize the one-year mark, from the initial case that was diagnosed here, we also recognize that there are countries, not just in West Africa, but around the world, where the infrastructure is poor, where it's crumbling, and which presents a setup for future outbreaks.
So let's talk about your big thing, which is preventative care. One of the hurdles, as I understand it, with preventative care is that people who use it tend to be in relatively good health. They tend to understand the benefits of doing things that are preventative, whereas the population that could best use those preventative care measures aren't really familiar with them, don't have great access to them. So how do you go about reaching different populations that could use that type of specific knowledge?
It's a good question. You know, prevention and health equity are the two priorities for my tenure as Surgeon General. And this is because I want us to be a country which is as good at preventing disease as we are at treating it. But I also want us to be a country where every person has a fair shot at good health. And right now, there are too many people who don't have access to the information that they need to stay healthy. But even if they know what to do, they don't have access to the tools through which to do it. Just a few weeks ago, in fact, my office released a call to action on walking in walkable communities. We were trying to focus on the fact that just 22 minutes of brisk activity a day can help you reduce your risk of heart disease and diabetes. And walking is a simple tool that almost everyone has access to. But we are also pointing out the fact that not all communities in America are walkable. Yeah. In fact, when you look at communities of color in particular, folks tend to live in neighborhoods which don't have adequate sidewalks, where safety issues make it hard for people. So you have to work with cities to help make sidewalks more walkable, communities to make them safer? Is that the type of thing we're talking about? Yeah, if you really want to build a culture of prevention in America, which is my goal, we have to engage all sectors in doing that. If you want to make America more walkable, then we need not
but
just city
making
planners.
America walkable is one thing. Telling or getting and persuading someone to go get screenings is quite another. I mean, that you have to get them into a hospital or to go see a doctor. You need to let them know that that's actually something that is, for instance, covered under the Affordable Care Act or something like that. So how do you provide that educational service?
Well, you provide it in part by empowering leaders in communities to share information.
Yeah.
That's an essential piece of it. But I don't want to underestimate the power that community organizations have to not just get messages out, but to change infrastructure. Because one thing that we have seen in pockets around the country is that when not just city planners, but when local governments, when parent organizations, when schools come together, they can really change things on the ground. In Florida, in fact, West Wabasso County, West Wabasso and Indian River County, they have 50% of residents who live below the federal poverty line. Some years ago, they made a decision that they were going to invest in making their communities more walkable. They spent 2.5 years investing in lighting, in sidewalks, in safe crosswalks. What they found is when they surveyed people afterward, 95% of residents had increased how much they walked, and they cited the changes in walkable spaces and lighting as being a driver of that.
So one of the things under this public health umbrella, I would argue under preventative care umbrella, is the issue of sleep. And the CDC recently said that sleep deprivation is a huge and growing problem. One, how many hours do you get a night?
Well, I average probably somewhere around 6.5 to 7.5.
That's not enough. You need more. And two,
Thank you, Dr. Stein.
This seems like a massive social shift to like encourage people to maybe get to bed earlier and sleep later, or leave the office earlier to rest and have that work-life balance. Do you feel like that's part of your mission as well?
Yes, because as all of us know, health is deeply intertwined with culture.
Okay.
What we eat, how active we are, how much we sleep. These are rooted in culture and norms. When I was training in medicine, for example, there was a culture in medicine that strong people didn't need sleep, that the less you slept, the more you just power through a tough call night on no sleep, the stronger you were. That's not helpful to have a culture that supports unhealthy practices like that. So we're really talking about shifting culture to promote and support
And we see it
health.
with drowsy driving, for instance, as a huge problem.
Yeah, we know, in fact, when I was in training, there were studies being done that looked at the impact of sleep deprivation on residents' ability to practice and on medical errors. And they found that when residents were sleep deprived, they made more mistakes. And this is true in many lines of work.
All right, cigarettes, good or bad? I'm just, they're bad. They're bad.
There's no
They're
mystery
bad.
on that.
E-cigarettes, a little bit more complicated. We've seen a massive rise in usage among teenagers. How worried are you about this?
I'm worried.
Why?
I'm worried because we have seen a rapid rise among kids. And while some people have raised the point that we need more data on e-cigarettes, and we do, we need to study it more. We need more data so we can answer questions about whether e-cigarettes can be useful or not when it comes to cessation of cigarettes. But there is broad agreement in the public health community that there is no reason that children should be smoking e-cigarettes. And we have more kids smoking e-cigarettes, which are a tobacco product right now, than we've ever had before. And that concerns me.
While we're on the topic of smoking, medical marijuana. Now, you've said some, I would categorize it as generally supportive things about the medicinal use of marijuana. You have not gotten to the point where you're endorsing its legalization for medicinal use. And I believe you've said that you want the FDA to study it more before you can come to that determination. Do you want to make news today and talk a little bit more about it, maybe endorse it?
Well, I'm happy to say exactly what I've said before on medical marijuana and
I
marijuana
basically
in general.
gave your answer. What do you say to those people who are, could actually have medical benefits in this moment from its use, who are waiting for its legalization?
So I'm going to clarify something.
Clarify. Go ahead. Sorry. Yeah.
So in your first statement, and I appreciate you trying to reiterate my points,
Yes.
but was one thing, and you were generally 99% there, but one point I want to make, which is that
a critical 1%.
a critical 1%, which is that what I've said in the past is that there are components of marijuana which have shown to be promising. That is very different from saying that medical marijuana is effective. And let me explain why.
Sure.
Because there is no data that we have, or insufficient data, that shows that smoking marijuana is helpful in relieving and alleviating medical conditions. Okay. Generally, in order to be approved as safe and effective, there are standards that we use, standards that the FDA holds any drug to when they approve it. And medical marijuana has not met those standards yet. Okay. And that is why it is not approved as a therapeutic right now for use.
Okay, fair enough. Switching a bit towards more politics-oriented stuff. Now, I don't know if
Marijuana wasn't political enough for you?
well, we can make it more. It shouldn't be. Have you been watching the Republican debates?
I've seen a couple of them, yeah.
Okay, so you've noticed in the most recent one then that Donald Trump has said that vaccines cause autism. And you might have noticed that other presidential candidates haven't gone there, but they have said that we should at least let parents space out the shots. So how much latitude should we give parents to space out shots?
Vaccines are what I began my tenure as Surgeon General talking about. I took office at a time where the measles outbreak had just taken place. One thing I want to state absolutely clearly, there is no link between the measles vaccine and autism. It is unfortunate that that keeps coming up from time to time.
Yeah.
That was based on a study that was debunked. It was fraudulent. That is simply not true. In fact, because of the measles vaccine, we have saved millions of lives all over the world. When it comes to the schedule, many parents ask the question, should we space out our shots? Are they all really necessary? And what I'll say is this, is that the schedule is based on a lot of study, a lot of experience, a lot of data. That schedule is what is proven to be safest for children. But if any parent has any question on how their kids react to a vaccine, on whether there are too many shots at a given time, whether their kids can really tolerate them, then I encourage them to speak to their individual doctor, because we recognize that every child is unique. That said, the schedule is there because it's been studied and proven and applies and is really there for all kids.
So, it's all right, yeah. It's fair. Does it frustrate you or does it concern you that the question is even being posed in these forums to begin with? Because in a way it adds almost a legitimacy to the idea that this is debatable.
Well, here's why I think it's important to talk about these things. One, to emphasize the point that this is not debatable in the scientific community, that the science is clear. Vaccines are safe and they're effective. But your raising it brings up another point, which is that in order to really get the message out, we need more than doctors and nurses and reporters talking about this, but we need people in communities, parents, teachers, individual healthcare providers, to actually be talking to their friends and neighbors, because we know that people take what their friends say very seriously on this issue. And while a lot of folks have access now to data, they need to hear from people they trust.
My question is raising it, I mean, this is a 25 to 30 million person watch debate. By raising it in this debate and debating it in that context, aren't we risking people getting the impression that, in fact, this isn't a settled science?
Well, what I think is harmful is making statements about a link between the measles vaccine and autism in large public settings. I think what that does is it makes people think that the science isn't settled. That's simply not the case.
Another debate we're having now is over funding for Planned Parenthood. If Congress were to remove federal funding to Planned Parenthood and give it to community health care centers, which is what congressional Republicans do want to do right now, what would be the public health care consequences in your estimation?
Well, there are many people around the country, and many women that I've cared for when I was practicing medicine up in Boston, who rely on Planned Parenthood for important services. And I think what's important whenever we're making any policy decision is to try to take it out of the realm of ideology and put it back in the realm of science and public health. And the truth is a lot of women around the country looked at Planned Parenthood as an important source of primary care services. The debate is focused a lot on a narrow spectrum of services.
3% of the abortion services, basically,
The truth is many women get they get basic health care and preventive care from Planned Parenthood.
And so if they were crippled in their mission because they lacked federal funding, would it have public health care consequences on that primary care function?
For the many women out there who looked at Planned Parenthood for basic care, I think it would be challenging for them.
I put this question, on Twitter I tried to solicit questions. The biggest question I got was what you think will be some of the biggest public health care challenges facilitated by climate change. Have you thought about it in that sense?
Well, I think you rephrase your question one more time.
Okay, well, let me see what I wrote down here. All right. People are concerned that climate change is going to cause massive societal disruption, correct? And they're concerned that as a part of that, there will be massive public health care challenges.
Yes.
As you look towards the future, as you study this stuff, what do you see as maybe some of the biggest ones that we'll have to deal with?
Yeah, so climate change
Did I phrase it better there?
You
Okay,
did.
good, thank
Good job, Sam. Climate change has a number of potential health impacts which are concerning. First, when we look at climate change, we see that climate change is associated with higher temperatures. Higher temperatures have an impact on the patterns of vector-borne illnesses like Lyme disease. They also have an impact on extreme weather events. And we know that extreme weather events, whether it's Hurricane Katrina, Isaac, or other disasters we've dealt with, have healthcare tolls. Some of them we can see, people getting injured, having to be hospitalized. Some of them we can't see, like the mental trauma that comes from that. But what I'm also concerned about is the quality of our air, because that has a direct impact on people's respiratory health. I've cared for many patients, younger and older, who have dealt with asthma. I had an uncle who died from a severe asthma attack. I know how horrible asthma can be for people who have it and for their families. And part of my concern around climate health is that it stands a chance of worsening our ability to deal with asthma at a time where too many people already suffer from it.
Okay. We have a minute left. I want you to just, I know that your initial tenure was defined by your confirmation battle, and probably unfairly so. Can you just tell us what it's like to be in the middle of something like that? I mean, remove the science and just talk about the toll it takes on a person's, life to have to deal with a year-long confirmation battle.
Well, few people choose to go through the confirmation process itself. You look forward to the opportunity of serving, but the process can be challenging. I'll say this: my confirmation process was challenging in a number of ways. But a couple of things that made me realize. One is it makes you realize who your friends are. And I found that my wife Alice, my family, my parents, and my sister, my close friends, became incredible sources of support for me during that time, and I will always remember that for the rest of my life. But the other thing that it taught me is to find and to hold on to my truth. Sure. Because at times where it's very easy to change a statement that you made, to try to whitewash an issue or a comment just to make things easier, you're faced with the decision about do you stay true to who you are or do you take an easier path? And what I have found through that process and in the days since is that once you lose your integrity, then you have nothing. And that process taught me to stick to my beliefs.
Well, I was going to ask you to applaud our guest, but you've already done that. So thank you very much, and thank you very much for sitting through this.
Thank you so much, Sam.